Hello. So today we are talking about fundamentals of population health, and this is the second module of the course PHM 3601. So there are a couple of learning objectives, actually three of them. The first is to describe the core functions and essential services of public health, as well as the foundations of population health. And then secondly, just going to identify a couple of public health metrics that is used as indicators for population health status, just basically to understand what the health outcomes within a population is. And then thirdly, we are going to define the different health theories and health policies that do help promote health well-being. So, beginning with objective one, foundations of population health. So, this you guys may have already seen this before. This is a an image that comes from the CDC, whereby it articulates the essential services, essential public health services, as well as the core functions of public health. So what you will see here is that you have the assessment, policy development, and assurance as part of the core functions of public health, and then within these four core functions, we are basically interested in making sure that there's equity, with services and both providing services and receiving services and access to service and utilization and all of that. So equity is at the heart of this core functions of public health. But at the same time, we have all of these functions, all of these public health services that all fit in with these functions. But a lot of these different services are not strictly assurance or strictly assessment or strictly policy development. They all kind of work in one way or the other, feed into each other. So that's why it's not being neatly separated to say this is assessment and stuff. All of that, even though assessment is, if you're really going deep inside it, you could say assessment is all about assessing population, assess and monitor population health and investigate. But you need this to be able to do the policy development part of it, and you need to also ensure equitable access as part of the policy development. So they are not all neatly divided out in the way that it seems in practice. They all kind of blend towards each other. But for this course, we're going to do a couple. This course is going to, tackle a couple of the services. We're going to talk about assess and monitor population health in one of the models, kind of addressing those services. Also going to talk about building a diverse and skilled workforce, ensuring enabling equitable access and create, champion and implement policies and plans and laws. So we're going to look at this as as a part, in this course is one of the topics we're going to talk about in this course. So, what are the foundations of population health? I'm going to talk about it in terms of kind of in four areas: the science of population health, the politics of population health, continuum of care, and then effects on or response to or by marketplace. So with the science of population health, we're kind of trying to understand, what we mean when we say health. Health is generally defined as a state of well-being, but all of that, there's so many things that that needs to be unpacked when we say state of well-being, and much of that, really looking at, as when we talk about population health, we're really trying to examine people's personal behaviors and health promotions, how all of that all come into trying to achieve the state of well-being. But the science also is looking at how to, science of population health is actually trying a way to move the conversations about health to move away from one patient at a time towards coordinated care. So when you do that, you have the idea of the population in mind, whereby you're not just seeing one patient as a silo or singular entity, but you're kind of seeing that patient as a collective part of a population. So you know that, let me use for example, if you have a patient who is, let's say, a migrant, for an example, you know that some information, some studies, some data, evidence-based data that has been done on migrants, the migrant population. When you have that patient in front of you, you need to have those data, at the core of your mind. So you're not just seeing that patient as just the singular person, but you're trying to see the population within the patient, so that you don't try to rule of things that you may kind of want to put a little bit attention to. I'm going to use an example. If you have a patient who is from a community or a population where they kind of have a communal eating, or stuff like that, when you're talking to that patient about their personal behavior, you want to pay attention to the fact that social norms hold a very strong sway in in how their personal behavior happens. So you don't want to completely eliminate those considerations about what the social norm within that population is when you're having that conversation with that patient. But also the science of population health also requires being very, very paying a lot of attention to evidence-based care, and of course the data analytics part of it, and trying to make sure that we are collecting data, and we're scrutinizing the data that we have, and we kind of pay attention to that. So it's really all about keeping the well, and through dedicated preventive health, but also in good treatment plans and continuum of care, which I'm going to talk about a little bit, just to make sure that those who are not well are kind of get healed, or you don't have a lot of the things that make it a little bit difficult for them to stay well, or rather to become well again. So that's really where the science of population health is focusing on. Then with the politics of population health, we are acknowledging the fact, what happens at policy formulation, implementation, both those that happen at local to international level, and trying to understand that. One of the assigned viewing that I included was a politics of health, political determinant of health. So I really want you guys to watch that video. And when you are watching that video, think about the politics of health and how much population-based lifestyle has a lot to do with the politics of what is happening in healthcare, and how what gets funded, or the kind of quality of education one gets. A lot of that has to do with politics, and even evidence-based practice. Depending on where it is that you live, some people do not have the luxury of having evidence-based practice, or having evidence-based research or data involved in their care, because they just happen to be that population that just gets overlooked or neglected when it comes to research, which is something that you guys may learn according to which. But it's there, unfortunately, some populations that don't quite make it in the research area as much as some do. So you have some populations that get over researched, and you have some populations that get under researched. So that is where politics of population does come in. But as a professional, you want to think about these things. And then of course we have the continuum of care. With continuum of care, what we are concerned about is that there is no kind of breach between having care in one part versus the other one. I can also use this example of the electronic health record, whereby people move around, right? People don't live in the same place, and as you are moving around in places, your risk could be getting higher, could be getting lower. But if we are not kind of tracking your movement in some form of way, you will not be able to tell where has this person been versus where has this person gone, is this person's ability to manage chronic condition having been affected by being in one place versus being in the other place? What are your chances of recovering from a catastrophic event as a result of being in this place versus being seen by this healthcare professional versus this that healthcare professional, or even the health policies around the places that you live, or at some point. So this is what we're when we're trying to pay attention to continuum of care, the whole purpose being that we want to make sure that we're maintaining wellness and well-being for every individual that is inside the system, and their acute illnesses are treated, chronic conditions are managed, they're able to recover from catastrophic events, and basically that they stay well into as long as they're able to do that. And of course, ideally everybody dies in their sleep, at a old age, but it doesn't quite happen, but that's the desire. But basically that's what continuum of care is interested in. We don't want to lose people because you're not paying attention to all the different phases in their lives and how their health changes in these different phases in their lives. And then we have the effects and responses to marketplace. Just read a little bit about the America's employment-based insurance, just to understand a little bit about. I don't want to talk a lot about it because it's something I want you guys to read up on. And then when you're also reading up on that, also think about workplace healthcare program. How health, especially in a country like the U.S., whereby healthcare is not being provided at a national level. Employers are providing employment-based insurance, but in addition to that, they're also including some form of health programs inside it to kind of help their workforce be healthier. No matter whatever is going on with the healthcare system in terms of universal health coverage, just trying to kind of get a little bit closer towards having a healthy workforce. And of course, we find some kind of awards that they kind of give themselves in trying to feel great about themselves for providing so many health programs, which I'm going to say this because this is kind of an American thing, because in well, not really America in this case. I'm just using America in this case. If you live in a place like Canada or the UK, for example, that they have their nationally provided healthcare system, there's a little less of workplace health programs being a thing of extra PR for per se, because a lot of the healthcare services, especially preventive programs, are kind of covered by the healthcare system. So the workplace do not necessarily have to do much of that, and when they do, it's just basically trying to have a lot of services that are not already being covered through this maybe the national health program to be done. So there's a little less of that back pattern that is done in those kind of countries versus in the US, whereby you have, people being quite reliant on healthcare coming from their employers. So that's for module one, sorry, learning objectives one. So with the second learning objective, which is the health metrics, so there are a couple of metrics that are indicators that we use in measuring health outcome, or as indicator of the health status of the population. So some of them you've kind of heard use. You have epidemic, and you have things like outbreak, cluster, endemic, you have pandemic, of course, being COVID-19. I think for me, until COVID-19, there wasn't a lot of experience that I've had, the word pandemic being used. It was mainly outbreak and epidemic that was, something that was used in the course of being a public health professional, but then COVID came and, we learned new terminologies. But you could just, at this point, just take a pause and just, read the different terminologies that are used as a way of measuring population health. The other terms that I use to measure burdens of diseases is things like incidence rate, infant mortality rate, and then of course we measure things like interrelationship between prevalence and incidence, whereby prevalence of a disease is a proportion of incidence times three. Okay, this is a bit complicated. I'm assuming you guys have learned about prevalence versus incidence rate. With incidence rate, we're saying these are we're looking at new cases of the disease. With prevalence rate, we're looking at existing cases of the disease plus the new cases. So that's what that is. And then, of course, we have things like maternal mortality rate, prevalence. Okay, there's this definition of prevalence here. And then we have things like proportional mortality ratio, standardized morbidity rates, and all of those. So these are the kind of measures we use in metrics or indicators that we use in measuring population health. So some of these metrics we are kind of on a population level. Things I'm going to use. Patient satisfaction, for example, is a measure of health, but it's generally not used at a population level as a way of measuring health status. So when I say health metrics, there's so many things that we use to measure health, but when it comes to population health, there are some of this rather special indicators for it, prevalence being one of them, mortality rates and ratios, and infant mortality and stuff like that. Those are the terms that are kind of population level metrics. So with the third objective is the theories of health. I'm not going to spend a lot of time with this because this is not very key in terms of this course. It's going to come up a little bit in the later module when I talk about health promotion and stuff. But we do have other health promotion theories, but I just wanted you guys to be aware that this kind of theories and models of health exist, so that when we now start talking about health promotion theories, you can always remember some of this, because some of them were kind of built on this foundation. So just pay attention to that. Be aware that they exist and what it is that they're talking about. But you're not going to be quizzed on what those things are. Oh, there's no quiz for this module. All right. So and with the Western scientific theories, we have the biomedical theory, reductionist theory, mechanistic theory, and then we have the salutogenic theory. So there are a couple of information that is provided on the module that is talking about all of them. So do read and watch them. But like I said, these are for more of a FYI thing rather than something that you need to focus on trying to describe or memorize what it means. So that's where we end for today's module. Do remember to use the Q&A board for clarification. If you have any question, if there's any part of this module you do not understand, whether it is the videos, it is the lecture, or if it's any of the articles that I shared, you can seek clarification on the Q&A board, or if you have any complaints whatsoever, you can have those addressed in the Q&A board. And that's it for today. Do you have a lovely day, and bye.